Hi, I'm Ben Alman. I'm the chair of orthopedics at Duke University. About 30 years ago, when I was in my orthopedic training, I treated a 4-year-old boy who had a desmoid tumor of his arm. And he lost the sensation over the outside part of his hand, and because of that, he kept on injuring his hand. And the physicians I was working with at that time amputated his arm because of this tumor. And since that time, I really have been interested in trying to figure out what caused that tumor and how we can prevent children and others with desmoid tumors from needing to get procedures like this amputation. About 15 years ago, one of the biggest advances in understanding and achieving that goal came about with the establishment of the Desmoid Tumor Research Foundation. This foundation, over the past 15 years, has provided funding that has substantially advanced our understanding of what causes desmoid tumors and how we can better treat them. More importantly, though, it's also grown the desmoid tumor research community and provided support for patients and families of patients who have desmoid tumors. The advances they funded have substantially changed the way that we manage patients, and today, a child like that first patient I saw 30 years ago would never get an amputation for this kind of a tumor. Now, desmoid tumors are rare, so big organizations that fund public health issues, like the National Institutes of Health, they don't always fund rare and unusual conditions. But for people who have a desmoid tumor, it's a real problem. It's a real disability and a problem with their lives. And so providing funding to organizations like the Desmoid Tumor Research Foundation will provide the funds that are urgently needed to come up with new and improved management for desmoid tumors to make the treatments even better, so that patients now not only will be able to avoid surgeries like an amputation, but will be able to figure out ways to make the tumor shrink down, provide less disability, and to allow patients with desmoid tumors to live more productive lives. So thank you to everything the Desmoid Tumor Research Foundation has done over the years, and I'm looking forward to another 15 years of continued success from that organization.